Welcome back to new video. Today we are going to learn regarding the one of the important health policy, that is a national health policy 2002. See, this is one of the important health policy that we are going to, in this policy we are going to focus mainly onto the introduction, definition, strategies, objectives, then the achievements, limitations, and the conclusion. So you also write it in the in this format only. Why? Because it attract the invigilator and you may gain the more marks in the exam. So let's start. See, this national health policy, it is implemented by the government of India, mainly for the government of India, for improving the accessibility, affordable, and the quality healthcare service to the community people. This is one of the importance of this health policy. Then the introduction. See, this was introduced in the year 2002, and the mainly updated in the year of 1983 policy, focus mainly on better healthcare service. This is one of the introduction regarding this healthcare policy. Then comes the objectives. See, what are the objectives of this health policy? Are they mainly some see, mainly the improve health status of an individuals into the urban and the rural area. This is one of the objectives of health policy. This health policy reduce the that is a mortality and the morbidity rate, means that is a disease rate and the death rate should be reduced. This is one of the main objective. Then the universal access to the healthcare, means healthcare access to be universal, means it should be all should everyone should get this healthcare access to the, that is all to the urban and the rural people. Then the key goals. What are the goals of this healthcare policy? We are the eradication of the polio. This is one of the important goal of this care policy, that is eradication of the polio and the leprosy. These were the some of the goals of this healthcare policy. Then they reduce the IMR and the MMR. IMR means infant mortality rate, that is the MMR means the maternal mortality rate. And they increase the life expectancy, means because of the disease condition the life expectancy was completely reduced, so that to improve that life expectancy, this policy were introduced. Then the important features. What are the important features of this healthcare policy? Was the decentralization, means distributing of the equal power to the all the healthcare sector, that is who are in charge, means they should all the healthcare sector should be equally power should be distributed, so that they can work actively in their areas. Then they increase health investment, and if this healthcare policy should run into the community and rural area, means there should be an investment from the government, so that budget planning, that is from the parliament, every year the budget have been should be completely some of the budget should be kept to the these kind of policies. It is one of the investment. Then the private sector participation. How the government sector has a very vital role in the healthcare sector, private sector also has an equal importance in the healthcare sector. They also plays in a very vital role, so that some of the people will be more focused on the private sector, so that involved in the private sector in this care of healthcare policy, which enhances and improve the healthcare facilities. This is one of the important feature. Then the focus area. See, this healthcare policy, it's focus on the mainly on the communicable diseases, then the non-communicable diseases, and the women and health. Why? Because these are the most risk group will be seen, because they are more vulnerable to the more disease condition, that is lactating mothers, pregnant women, and the adolescent girls, and the under 5 children's, neonates. These are the some of the groups where who are under the risk for the most of the diseases, so that they have focus on these areas. Then comes the strategies. What are the strategies that have been implemented by this policy? Was the Ayush integration, means Ayurveda, Unani, Siddhi, homeopathy integration. Means why? Because in some of the community areas completely people are dependent to the Ayurvedas, their homeopathy, so that this integration also help them to improve the healthcare facility, improve healthcare standards into the community areas. And the disease surveillance, so that disease surveillance it should be done, so that we can easily identify them who are under the risk, which areas under the risk, so that healthcare facilities can be improved in that areas focus. Then the health awareness into the community area. These are some of the strategies done by the this healthcare policy. Then the achievements. What are the achievements after they have been done by this healthcare policy? Were the polio eradication. Polio completely have been eradicated. Then the better immunization service to the healthcare facility to the rural areas, and the public awareness have been improved. These are some of the achievements done by this healthcare policy. Then the limitations. What are the limitations? Means everything you think you can take any of the policies if they are having any of the good objectives, good role, means in same way they are having showing some of the limitations. That is a low funding from the government on this healthcare policy. This is one of the limitations. Then the rural and the urban gap have been seen. Then the workforce shortage have been seen. These are some of the limitations. Now we are into the conclusion part, so that we are going to conclude by saying that strong foundation by the healthcare and the focus on equity and access, these are the some of the uh, key roles of this healthcare policy that lead to the NHP. Further is that national health policy 2002 leads to the national health policy 2017. These are some of the uh, important features regarding the healthcare policy, that is NHP 2002. I hope so that you understood, and you can take the screenshot and you can write the notes, and mainly write in a point wise, and first introduction, definition, objectives, strategies, achievements, limitations, then the later the role of nurse, role of that is a medical practitioner. So this is how you can attract the, that is a invalidator, and you can gain the marks. I hope so that you understood, and subscribe for more, and we are going to come with the more videos of regarding the these kind of the community, and the MSN, then the pediatrics, all the subject we are going to cover. Thank you.